President Trump issuing an ultimatum to Congress: repeal Obamacare or no more personal health care perks for them. Earlier today, the president tweeting, "If Obamacare is hurting people, and it is, why shouldn't it hurt the insurance companies, and why should Congress not be paying what the public pays?" The president was referring to an insurance carve-out that has American taxpayers paying a portion of the premiums for members of Congress like a business would do for their employees. South Carolina Senator Lindsey Graham met with the president just days ago to find a way forward on health care, and he joins me now. So we're lucky to have you in studio tonight. What did you make of that big change today with General Kelly? You know the general well.
You couldn't pick a finer man to be chief of staff. I've served with him in Afghanistan. The Marines have landed in the White House, and they've got a beachhead, and I hope they can hold it.
And did you think that that was a good decision today to remove Anthony Scaramucci?
Well, I'll leave that up to the president, but I think we got a chance for a fresh start. None of this matters if we're successful. If we fail on health care, I don't care who he hires.
So last week was kind of a bummer on health care for the Republicans, and the president is saying, do it now. Can you do it?
I am like 1,000% with Donald Trump on this. We should be politically horsewhipped if we don't try again. The best idea we haven't even brought up: take all the money under Obamacare and block grant it back to the states. That ends single-payer health care. The government closest to the people is the best government. The health care closest to the people is the best health care. We had Republican governors up in the White House today. We looked to Washington to fix Obamacare. We should have looked to the governors. I'm excited about Graham Cassidy, which empowers governors. 4 states under Obamacare get 40% of the money: New York, California, Massachusetts, and Maryland. My goal is to make sure that if you live in South Carolina, you get the same amount of money from the federal government as you would if you lived in California, with more flexibility. It'll put Democrats in a box. It will make health care more accessible to you. If you don't like what's going on, you complain to your governor or your state house guy rather than a bureaucrat in Washington. I'm so excited about this. Mr. President, don't let us quit. Make us keep trying. I think we can pass this bill to block grant the money back to the states.
So for the senators who voted against the bill last week, do you think that they could vote for something like you're describing?
John McCain said the process was broken. We voted on amendments we didn't know anything about. The skinny bill didn't sound too good to begin with. I really do believe if you had Graham Cassidy, Mike Lee, and Ted Cruz have good ideas, if we took a really principled position on health care, that we should send the money back home closest to the patient, and had hearings and votes in the normal course of business, that we could get this done. West Virginia, under my approach, gets 43% more money than under Obamacare, with more flexibility. Montana, where a Democrat exists, gets 200% more. So the bottom line is, by 2026, we want to make sure that every state gets the same. Block granting works. And Mr. President, you make sure that we try this before we say we failed. We haven't even begun to fight yet.